I wanted to start today with Obamacare, and we're now several years into the 3 years almost into the passing of Obamacare, and a bit more into the implementation. Ralph might argue that he's been operating under Obamacare for much longer than that in Massachusetts. But Ralph, perhaps starting with you, how has Obamacare affected your business models, and how do you see the impact going forward?
So, well, healthcare reform or Obamacare fundamentally changed. I mean, we're a company that was created to fill the niche that was created by Obamacare. So what are good and bad and the ugly of healthcare reform, Obamacare? So first is the good. I'll start with the good. I'm a physician, I'm a doctor, I'm a heart surgeon, and I know some people argue with me, but I think that it's a right for Americans to have access to healthcare, and not just emergency healthcare when it's too late, primary care, et cetera. I think that's a right. So I agree with that component of the Affordable Care Act and healthcare reform. The problem is that no one reformed healthcare. All they did was increase access. And lo and behold, you don't have to be a Nobel Prize-winning economist to know that if you increase access without increasing or changing the way that healthcare is delivered, you're going to have higher costs. But no one kind of thought about it. So from our perspective, that was a problem. That's a problem we face in Massachusetts. The cost got pushed down to small businesses. It got pushed through the self-insured market by changing plans and reduction of benefits. But there was a cost shift that happened that was pretty dramatic. So I think that the other problem with healthcare reform is that the government did this great job of passing all this legislation that drives people towards a more integrated continuum. The thing of it is that nothing applies to them. Nothing applies to Medicare. Medicare is still 65% of the cost. And I'll tell you, in our Pioneer program, and we were talking about this earlier, if you look at all of our patients, and we have 80,000 patients in this quote-unquote experiment. We don't think it's much of an experiment, but we have 80,000 patients in it. And if you look at every demographic and comorbidity and isolate, do a multivariate analysis, one thing and one thing only kicks out having a 20% determinant in cost. And that's whether or not people have a primary care doctor. That's not if the primary care doctor is a gatekeeper. That's the next step. I'm just even choosing a primary care doctor. So when we went to Congress and said, look, here's this great data, just have people pick a primary care doctor. Absolutely not. So in other words, they're telling the commercial market, all of us who pay commercially for insurance, how to run it, how to integrate it, how to provide this care structure down to population health management, yet Medicare itself is unwilling to tell its beneficiaries, oh, you need to pick a primary care doctor. That's a fundamental problem.
Joe, how has Obamacare impacted how you run your organization and how you go to market?
I think Ralph's comments were they're germane to this part of the country as well. It really was the environment. We all understood inside of healthcare that the trajectory of spending, the consumption of resources simply wasn't sustainable. You see healthcare crowding out so many other public goods, lots of discussion about healthcare versus education, healthcare versus highways, healthcare versus defense, et cetera, and so on. We knew that we needed to change. We knew that we needed to reform, and we also knew that reimbursement was going to lag that. You were going to do a lot of things for which you were not paid, but they were the right things to do, first and foremost for patients, and secondly, they would just make you more efficient, and somehow it would all go into the healthcare black box, and it would work out to your benefit. What Obamacare has done is kind of doubled the bet and quickened the pace. It has not done a thing to transform healthcare. It may have provided additional impetus to transform the way care is delivered, but we're not seeing any really discernible impact other than the motivation has increased.